Pleuritic chest pain. Definition is an inflammation of the membrane that surrounds and protects the lungs, the pleura. Description is a condition that generally stems from an existing respiratory infection, disease, or injury. In people who have otherwise good health, respiratory infections or pneumonia are the main causes. Infections including pneumonia, tuberculosis, and other bacterial or viral respiratory infections. Immune disorders, including systemic lupus erythematosus, rheumatoid arthritis, and sarcoidosis. Injury from a rib fracture, collapsed lung, esophagus rupture, blood clot, or material such as asbestos. Symptoms. Although the pain can be constant, it is usually most severe and the lungs move during breathing, coughing, sneezing, or even talking. The pain is usually described as shooting of stabbing, but in minor cases it resembles a mild cramp.
The distinctive pain of pleurisy is normally the first clue physicians use for diagnosis. We talk with Dr. Michael Lovey of Desert Regional Medical Center in Palm Springs, who explained the symptoms and treatments for this disease.
Pleurisy is just a description of a patient's complaint. The pleura, or the lining of the lung, is irritated or is a source of pain, and what the patient will complain about is a discomfort in the chest wall when coughing, taking a deep breath, leaning over, or even moving the shoulder. It can radiate up into the shoulder, and it's usually a sharp pain, and certainly gets your attention.
Dr. Lovey told us what causes pleurisy.
Pleurisy can be caused by any of a number of things. If it's serious stuff, could be infection. If you want to go by the odds, pneumonia. It's right next to the lining of the lung, and there can be irritation that way. Another very serious thing would be a blood clot to the lung, and that's why many patients have a sense of urgency when they have this severe, sharp pain beginning suddenly, something they didn't have before. They're going to go to the emergency room. Doctor is going to be thinking about blood clot to the lung. The ribs are right next door. If you had a minor trauma, you could pop a rib, and that could feel like pleurisy. If you have a gallbladder attack, go up to the side of the chest wall, that can feel like pleurisy. If you had a compression fracture of your spine, upper thoracic spine, and it irritates the nerve, it can send pain around the chest wall and have a pleuritic quality in terms of aggravation with movement or respiration. And then it can be any of a number of things, autoimmune problems like lupus or inflammation of the lung related to even rheumatoid arthritis.
Diagnosis. Doctors usually feel the chest to find the most painful area, which is the likely site inflammation. A stethoscope is also used to listen for abnormal chest sounds as the patient breathes. If the doctor hears the characteristic friction rub, the diagnosis of pleurisy can be confirmed. Sometimes a friction rub is made by the presence of pleural effusion, and further examination is needed for an accurate diagnosis. Treatment.
The etiologies are so diverse. It can be anywhere from antibiotics to anticoagulation to, if it turns out to be a cancer problem, there would be cancer therapy, or if it's inflammation, it would be anti-inflammatories.
Thanks.